everything might not be fun.
Yeah, the politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out.
This is the thing, I'm just getting totally unhinged now, and I don't know what to do. Hey, how's it going? So it's a nice icy snowy day in the bay, and it's pretty warm out. It's not bad. So I wanted to talk a little about primary care. We have talked about that before, but there's a lot of stuff going on in Maryland, like I talked about, that's trying to reduce the cost of total health by enabling primary care providers to have a little more control. But the question is, how can we do that when, like we talked about last time, the system is basically not involving the patients at all? I mean, I believe, like I said, that if we empower patients, give them real access to information so they can make informed decisions about procedures and interventions and medicines, they would likely reduce healthcare costs by billions of dollars a year once they learn that most of the stuff they are told they have to do actually is not important. There's a body of literature out there that says that primary care, if it's enabled, if it can control the system, would save the system tremendous amounts of money. Outcomes would be better, hospitalizations would be reduced, and patient satisfaction would increase. We're not there yet. Myself and two of my colleagues wrote a two-part blog in Health Affairs, which is a health magazine, about this. The first part, we talked about the evidence out there to show that primary care actually can make a difference. The second part is we came up with some innovative ways to do that. If you look on my website, Curing Medicare, or if you just Google my name and Health Affairs, you can find those articles. What we'd like to do in the primary care world is enable us to have some control over what goes on outside of our realm. So there was a bunch of us in our county who got together the other night, a bunch of primary care doctors, talking about how do we basically help our county reduce healthcare costs. The hospital has a vested interest in this because they're going to be responsible for total cost, which is a great thing. So they gathered us together. They gave us some Panera sandwiches. I had 2. No dessert, which is always a problem. But we kind of talked amongst ourselves. We all had very different views about how to do this, but we all agreed on a few things. And a lot of this is not only our experience, but also it's proven. Number one, we think we can handle the vast majority of what our patients deal with. Even when they go to an endocrinologist or a cardiologist, we really don't want them to go there other than for a quick consultation, and then we want them sent back to us. We can take care of all the other stuff. We know how to take care of diabetes and thyroid disease, atrial fibrillation, coronary artery disease. I would venture to say we could actually do it better than they can because we know our patients well and we know all the other problems the patients have medically that help us to help them make a good decision. We also have a rapport with our patients that says, okay, you guys make the final decision, we're just going to help you get there. We don't want to step on you. So, the best example of this, I always say, is that I could send my patient to a cardiologist for atrial fibrillation, but they will just knee-jerk put them on blood thinners. They'll never discuss the risks and benefits of the blood thinners. They'll never look at the other factors in my patient's life that would influence that decision, and they will never give the decision to my patients. They just do it. That just happened to a patient the other day. They found atrial fibrillation on a monitor and called in 2 prescriptions, one of which was a blood thinner that is dangerous. And my patient knew it because she's heard my blogs. She's heard my podcast. So she immediately called me and questioned this. And she came in and we talked about it, and she decided not to do it, which I think is a good decision. But here I send this patient goes to an expert. You'd figure that expert would know the nuances of all this, would have a thorough discussion with the patient. That's why they're an expert. No, it's just protocol and knee-jerk. This is true of diabetics of mine that go to endocrinologists. They just get thrown on high levels of insulin all the time. Kidney doctors get pushed to dialysis, get put on hocus pocus medicines. Rheumatologists, people are put on biologic medicines when other simpler, cheaper, more proven medicines might help. All this stuff costs the system tons of money. It's not good for my patients either, but they are led to believe this is the best way to go. So a primary care system, what was really interesting about what we talked about in our group was maybe if we collectively, as primary care doctors, create contracts we have with the specialists, we could say, you know what, when we send someone to you, let's say a cardiologist, we want you to just see them once or twice for consultation and then send them back to us. We don't want all these tests done. I mean, people were shocked when I talk about that the cardiologists who see my patients every year do a series of 4 tests: stress tests, echocardiogram, carotid, and Holter monitors. These tests have no value. In fact, they've been shown to be dangerous when done on patients without symptoms. And yet they do them. Why? Because they own the equipment. Of course they're going to do them. It's all their money. But the amount of money that is spent on stress tests and echocardiograms alone that are unnecessary is a big chunk of our healthcare dollars. And so this is where we got to rein in the costs. And who's better to do it than primary care providers? So I'm hoping we could eventually have a primary care healthcare system. That's what we're pushing for. That's what this Health Affairs article is really looking at. But that's what I've been pushing for, and so many others have. Primary care providers are not well organized. We are the lowest paid. We have the least amount of money we bribe congressmen with. So we're stuck. The committee in the AMA that determines physician salaries doesn't have primary care doctors that are a big part of it. So they give all the money to the specialists. It's a long process. Myself and one of my colleagues is going to be writing a book about this, and I'll let you know when it comes out. But the bottom line is that's how you save the system. You go to your primary care doctor, your expectation should be not that they're going to send you to a bunch of specialists, but they're going to talk to you about the risks and benefits of all the interventions. And the goal is that we shouldn't send you to any specialist other than if we're confused a little about something or we need a little extra help, we might send you to them for one visit and then that's it. Just as a consultation. That's what specialists are supposed to do, consult. Why do they keep seeing people over and over again? Why do they keep doing tests on people over and over again? It doesn't make sense. So that's what I'm hoping for, is that we get to the point of a primary care healthcare system. And take a look at the Health Affairs article and see what you think. And we're going to keep pushing for that. My hope is that Medicare in its own subtle ways is kind of getting to that point. And this new program in Maryland might enable us to do that by forcing the hospitals to look at their costs and realizing, you know what? The cardiologists are responsible for 15% of the entire healthcare budget. Why is it so high? Maybe we could cut that down by having the primary care doctors put a curb on all the testing they do. I think they're realizing that. So that puts us in a little bit of a better position to try to address these costs, but more importantly, a better position to put the patient in the equation, give you guys information so you can make good decisions along with us. We don't get money from doing all these stress tests, so we're the best ones to actually.
Hey, so if you're equally annoyed by our dysfunctional healthcare system and all the garbage you're being fed, then give me an email, log on to my website, which is listed down here. Let me know what you want me to talk about, and I'll just keep feeding you information, and we'll discuss this and hopefully make some changes. See you later.